Did you know that between 80 and 100% of adults will experience low back pain at some point during their life? Now, for many people, this will be a transient experience in that they'll have it for a couple of days, maybe they'll rest or take it easy, and then the pain will go away. However, if you've been living with this pain for more than a couple of days, you know that low back pain can become a chronic issue. And when it becomes chronic, it becomes more difficult to deal with. You see, low back pain can be caused by a multitude of things, including discs, muscle tension, ligament injury, or even nerve problems. But once one of them start, it can also become a cascade of symptoms. So some people will start with maybe a disc problem and it just kind of goes away after a couple of days and they're able to move on with their activities. While other people will suffer with a disc problem that leads to ligament issue, joint issue, arthritis forming in the joint, and increased pressure that goes into the nerve. Which means it is really important to treat your low back pain just as soon as it starts, because we don't want it progressing and involving some other tissues. So that's why today we're going to cover my top 5 favorite stretches and exercises to do if you're suffering with low back pain. Now, these stretches and exercises are safe to do if you have any form of low back pain, no matter what is the root cause of it. However, I do want to say that if you are suffering with sciatica symptoms, and that is nerve pain that goes down into your legs, these exercises may not be the best for you. I'm going to recommend you check out this video over here for stretches and exercises that are safe for you if you do have nerve pain that's traveling down into your legs. So if you're still here, I'm going to assume that what you're struggling with is actually low back pain. So let's get started. All right, our first stretch is going to be the figure 4 stretch. Now, the goal of the figure 4 stretch is to stretch out the muscles in the hip. And this is important because the muscles in the hip attach to the muscles in the low back. But you should not be feeling a stretch in your low back when you're actually doing this exercise. So please, if you feel a stretch in your low back, then stop. This is not the best stretch for you. In order to do the figure 4 exercise, you're going to start laying on your back on either the bed or the floor. You're going to keep your knees bent up, feet flat on the ground. You're going to bring one foot, you're going to cross it over the opposite knee. Now, this may feel like enough of a stretch in your hip for you. If you feel like you need a little bit more, you're going to use your hand to push your knee away from your body. And this will help to increase that stretch in the hip a little bit. Now, if that still doesn't feel like enough, I'm going to show you in the next step. But again, I do want you to be really, really careful that it doesn't cause you to feel it in your low back. And that is to bring the opposite leg towards your body and reach behind. Now, holding this position here helps me to feel a really good stretch through my hip, but I am not feeling anything in my low back. And obviously, if any stretch is increasing your pain more than just a stretch pain, then please don't do it. I recommend holding this for 10 seconds, and then of course, you want to go do the other side. And do that for 3 cycles. Now the next stretch is to stretch the front of the hip or the psoas muscle, which is the hip flexor. This is hip flexion when you're bringing your knee towards your chest. Now, the important thing about the psoas stretch, or about the psoas in general, is that the psoas actually attaches onto the lumbar spine. You see the vertebrae have these arms that stick out to the side, and they're called the transverse process. And the psoas actually originates from the front of the transverse process. So it's very important to make sure you have your low back in the correct position while you're doing this stretch. So you're going to be laying off of a couch or a table or your bed. You want to make sure you can put one foot down on the ground. Now, if your bed is too high, you can build up the floor with either a step or some pillows. We're going to leave the other knee bent up because this is what's going to help protect our low back and make sure we're not getting into too much of an arched position. Now, for me in particular, this table is a little bit low, and if that's happening to you, you can sneak your foot back a little bit, which will allow you to drop that knee down even further. And now I can feel that nice stretch in the front of my hip right here or in my psoas muscle. You're going to hold that for 10 seconds, and then you're going to bring your feet back together to give it a break for 10 seconds. Now this one you can do from side to side, but it's a little bit more difficult with the setup. So usually if I'm doing this, I'll do a 10-second stretch, relax for 10 seconds, and then go back in and do it on this side before switching all the way over to the other side.
No matter which side your low back pain is on, you want to make sure that you stretch out both psoas muscles, and you're going to do 3 sets of those.
So the next exercise we're going to do is called supine caudal rotation, and it is absolutely my favorite exercise for anybody who is suffering with low back pain. The reason why is because it activates the lumbar multifidi, and these are the small little muscles that are in our lumbar spine. They make like a Christmas tree pattern all the way down our spine, but definitely in our lumbar spine, and they help to control joint motion. So when your big muscles are helping you bend forward or bend backward or side to side, the multifidi are the little ones that keep those joints from jamming into each other. So this is a great exercise to be able to activate those muscles without activating those big muscles on the back.
In order to do this, I'm going to have you start laying on your back with your knees bent up and your feet flat on the mat or on the floor. What you're going to do is bring your knees a little bit down to the side just until that opposite hip starts coming up. Then you're going to use the muscles on the front, the abdominals, to push that hip back down and bring the knees back. Knees come down, hip comes up, hip comes down, knees come back. We're going to do 20 reps to one side, and then of course we'll want to do 20 reps to the other side. I don't recommend going back in a tick-tock type of fashion because that makes it difficult to know which area you're trying to control.
Now for the supine caudal rotation, we want to do 2 sets of 20 to each side. Now, the next exercise is also one of my favorites, and I usually recommend it for my pelvic floor patients because it works the pelvic floor musculature. However, if you're suffering with low back pain, chances are good that your pelvic floor is taking the brunt of it. So we want to make sure to keep that nice and healthy and happy as well. So for my favorite pelvic floor exercise, which I also always do in regards to low back pain, let's get started. For this one, you're going to start with your knees bent, feet hip width apart. You're going to keep your heels where they are, and you're going to slide your toes towards each other without lifting them up. It's kind of like a windshield wiper type of exercise. You're going to do 15 reps this way, and then when you're done with that, you're going to slide your feet and your knees together. You're going to keep your heels together this time, and you're going to slide your toes away from each other. Now, as you'll notice with me doing this, there's significantly less motion this way than there is the other way, and that's perfectly normal. Most people have that. Just go as far as you feel comfortable going. What I find in most cases is that people will really try to use their toes to get more motion. Ow, that actually literally hurts in my calves. So don't do that. That's not what we're trying to do. Just let them slide as far as they feel comfortable with, and the toes are just going along for a ride. Okay, so we've worked the low back muscles. We've gotten the multifidi activated. We've got that pelvic floor on board. What's next? We need to work on those abdominals. Now, I like to do that with adding in some deep breathing for multiple reasons. One, we want to make sure that we're not doing breath holding, which can happen a lot whenever we have any pain, but particularly with low back pain. And two, because it activates the vagus nerve, which is your feel-good nerve, and who couldn't use more of that in their life?
All right, so to do this one, we're going to start with the deep breathing. So you're going to do a deep breath in through your nose, making a big belly breath. And then we're going to breathe out through our mouth like we're blowing out a birthday candle with an abdominal contraction as we're coming down. Here's what that looks like. Breathing in and out. Now you'll notice when I get to this abdominal contraction down here, there's not a lot of motion that's happening through my pelvis or my low back. It's just helping to squeeze out the last of that air and get that entire abdominal activation. But our goal is not to cause a lot of motion to happen through here because that can actually increase your low back pain. So one more time, deep breathing in, making that big belly breath, and out. With that nice abdominal contraction at the end. So there are the top exercises that I recommend if you are suffering with low back pain. I definitely recommend that you start them as soon as possible. And many people will ask me, how long will it take me to see results? The truth of the matter is it depends on how long your low back pain has been happening for. If your low back pain is only a week or two old, you probably will feel results almost instantaneously, if not within 24 hours.
However, if you've been suffering with low back pain for 6 months or even longer, chances are good that it's probably going to take you longer to see results. However, the importance is to remain steady with these exercises. The great thing is they are super gentle, so you can do them every day, and building up that consistency will build up your flexibility and your endurance. You may only notice small changes in the beginning, but small changes can lead to big changes over time. So stay consistent with these exercises and keep working towards your low back health.